Once I had a patient, a gentleman in his 50s, with severe knee pain. This gentleman is usually very active. He used to play a lot of racket sports, pickleball, tennis, but one fine day he had severe knee pain and he decided to come and have a look at his knee. And that's when we decided to do some scans and we found out that he had chronic osteoarthritis of his knee. Hi, I'm Dr. Nivan Loganathan. I'm a consultant anesthesiologist and a pain physician. I treat all sorts of back pain, neck pain, multi-joint pain, and I have a clinic at Farrer Park Medical Center called Total Pain Specialist Clinic. So this patient came in for a consult and his knee looked very swollen. Upon further examination of his knee, we found that there was fluid in the knee and there was limited mobility of the knee. We did scans and we found that the knee had degenerative changes, and these degenerative changes contributed towards his severe knee pain. So this gentleman had severe knee pain. The knee pain started on the medial aspect of the knee as well as the anterior aspect of the knee. This pain was due to the sensory nerve fibers of the genicular nerves coming from the superior medial aspect of the knee, the inferior medial aspect of the knee, as well as the superior lateral aspect of the knee. And these nerves can be targeted to treat them to reduce pain coming from the knee joint. So we had to run a series of tests for this gentleman. We did x-rays and we did a bedside ultrasound for him, and we found that he has chronic osteoarthritis of his knee joint. So this gentleman was found to be suitable to undergo knee genicular nerve ablation. Normally, this condition is treated conservatively using anti-inflammatories, stretching, as well as rehabilitation, for example, physiotherapy. These are all conservative measures which can treat the knee pain. However, in this gentleman, since the knee pain is so severe, we had to consider other options, and the options included pain interventions to treat the pain originating from his knee. Now, the pain generators in his knees are the genicular nerves. So we targeted the genicular nerves using genicular nerve ablation, radiofrequency ablation, to reduce the pain coming from his knee joint. So genicular nerve ablation involves the treatment of burning the nerves of the knee joint. So how are these nerves burnt? Needles are placed adjacent to the nerves, the genicular nerves, and heated up using electrical probes. So now when the electrical probes are being heated up, the nerve degenerates. And when the nerve degenerates, the pain coming from the joint disappears. Patient gets significant pain relief from this procedure. Generally, patients get a diagnostic block first. A diagnostic block is defined as an injection with local anesthetic and using steroids to reduce the pain and inflammation coming from the nerves. Once the patients have a positive diagnostic test, patients can then be deemed suitable to undergo the radiofrequency denervation of the genicular nerves. So for this gentleman, we did this procedure as a day surgery procedure, and he had significant pain relief after the procedure and he went home the same day. Most of the patients who undergo this procedure need some form of physiotherapy, some form of anti-inflammatories, and a little bit of rest after the procedure at home to get full functionality and to improve their rehabilitative process. This gentleman benefited significantly from radiofrequency genicular nerve ablation, and he returned for a review a couple of weeks later, fully functional, back to his normal activities, able to do some walking. He went for some hikes and even went back to playing his pickleball. He was very happy with the procedure and the rehabilitative process. So knee pain is not the end game, and you have many options to treat knee pain. One of the most straightforward options is to get genicular nerve block or genicular nerve ablations, and don't wait long to take action to treat your knee pain. Decide now and seek treatment from your pain specialist to get the best options available.